No. An unclear or missing visible result does not establish that greater intensity is the right correction. Before changing depth, passes, frequency, products, or cartridges, check 6 separate variables. First, goal and concern. What change was actually being observed, and was the concern classified clearly enough to compare? A flat color change, uneven texture, an indented area, and an active skin condition are not the same decision problem. If the concern is unclear, do not jump to a stronger setting. Second, observation quality. Were the baseline and follow-up recorded with the same lighting, camera angle, distance, timing, expression, and skin state? Research on before and after photography shows that brightness, rotation, size, background, and makeup differences can exaggerate apparent improvement. If the images are not comparable, the result is unknown. Third, evidence time horizon. Was the expectation borrowed from a source that studied the same concern, population, method, setting, endpoint, and follow-up period? A study average is not a personal deadline, and evidence from one concern cannot automatically forecast another. Fourth, device state. Separate the product system question from the outcome question. Confirm the exact model, cartridge family, seating, power, display response, and seller support path. A device check does not prove a skin result, but an unknown device state makes the outcome harder to interpret. Fifth, method concern fit. Was the selected method even relevant to the classified concern? Product preference, model prestige, or higher number cannot replace this decision. If the concern, method, or evidence scope does not align, reassess the method instead of intensifying it. Sixth, adverse or uncertain trend. New or worsening irritation, infection signs, pigment change, or another concerning response changes the route. Stop interpreting the question as a shopping or intensity problem. Defer and seek qualified input when the decision exceeds a consumer comparison. After those 6 checks, choose the narrowest supported output. Continue observing when the record is comparable but incomplete. Rebuild the baseline when the evidence is unstable. Troubleshoot the device when product state is unknown. Reassess the method when the concern and evidence do not align. Stop or seek qualified input when the trend is adverse or outside the at-home boundary. The FDA notes that microneedling may not always produce the desired aesthetic outcome, and that risks and suitability limits matter. That does not tell an individual what setting to use. It tells us why uncertainty should not be converted into escalation. DrPenX publishes this decision path to reduce guesswork. No result does not automatically mean more intensity. Use the narrowest supported conclusion. Preserve the observation record, name the unresolved variable, and route that variable to its correct owner. Unknown is a valid result. Stronger use is not the default answer to missing evidence.